one analogy I use for mechanical problems in the body or joint derangements is the analogy of the kitchen drawer. Sometimes that drawer is not moving mechanically well, it's not able to open and close fluidly, and if you jostle it and wiggle it in lots of different directions, it will normalize. It will start to move well again. But sometimes it takes a very specific direction. You may not know exactly what you're doing when you move it, but you move it a certain direction and there it goes. It starts working well again. That mechanical concept of joints in the body is an orthopedic principle put forward by McKenzie starting in the 1950s, and it's in contrast, or it's a different diagnosis from muscle lesions, tendinopathies, or structural lesions in labrums, menisci, bones, and other structures. And of course, those pathologies in orthopedics do exist. But I find, once I learned McKenzie's work, which is, established in 5 different textbooks, it's the idea that is the foundation of his books, Treat Your Own Back, Treat Your Own Neck, multiple other books geared towards the layperson. What I found when I learned his work is that it is true. Most problems in the human body, orthopedic-wise, have to do with mechanics. And if you find them and correctly diagnose them, you will start to investigate which direction does the joint need to start moving mechanically well again. For a lot of patients, it's moving in directions of the joint that they don't move into on a normal, regular basis. For example, there are not many mechanical problems in the neck joints that need to move forward because most of us spend most of our days forward. And a lot of mechanical problems in the neck respond to movements backwards. Retraction, extension, and there are different loads. There are dozens and dozens of different movements or exercises we can apply to mechanical problems. The issue is finding the one that works the best. Of course, there are people who, just like in my kitchen drawer analogy, move in lots of different directions and restore the joint to normal, abolishing signs and symptoms on their own. Those patients are not going to be presenting to clinicians. But a joint derangement is going to present with symptoms, sometimes local and or referred symptoms from the mechanical joint derangement. It can present with weakness in certain muscles, nerve tension, other functional problems such as poor balance or loss of sensation. But the point of this diagnosis is that if you move the joint in a specific direction, sometimes two, on a repeated basis, and minimize movements in the directions that make the joint derangement worse, it will resolve. All the signs, all the symptoms that are attributed to that pathology will resolve if you find the right movement the joint needs and move it repeatedly into that direction.